much. Thank you to the panel for their testimony. I was over in VA. Apologize, but that's very important as well. I wanted a question to Mr. Smith. You mentioned in your testimony the potential cost savings benefits of telehealth. Do you believe that it is feasible to expand the use of telehealth to Medicare to effectively lower its costs?
It's a simple word, absolutely. So I could go on, but we've seen the impact of telehealth and telemedicine. NEHI, New England Healthcare Institute, the VA program. There's a rich history of information, some of which I've provided in my written testimony, about the beneficial impacts not only on outcome but also on costs. And so it seems obvious that we can extend that to patients struggling with chronic disease independent of how their healthcare bills are paid.
Very good, thank you. Follow-up again to Mr. Smith. With doctors showing increased reluctance to accept new Medicare patients for obvious reasons, you believe that allowing doctors to use telehealth will enable them to expand their reach and not only treating existing patients but also increase access by enabling them to treat new beneficiaries. If you could elaborate a little bit.
Sure. I think the technology obviously enables that notion of care at a distance in ways that are much more efficient and save, in addition to the costs associated with travel, save many of the costs associated with unnecessary or untimely ER visits or doctor's office visits. But I think it's not enough to have the technology enable it. We also have to have payment mechanisms that provide appropriate incentives for use. And so I was talking to a colleague who's a dermatologist, and I asked about the world of teledermatology. And he says, you know, it's never going to take off because I don't get paid for it. I think that is an unfortunate but rational statement.
Very good. Anyone else on the panel wish to comment?
I'd like to just specifically on that point about taking on more Medicare providers. I think that when we talk about telemedicine, we think about it in a traditionally rural setting. So this is the idea of someone who lives in the country that doesn't have access to advanced care facility that's using telemedicine to connect to that. But especially from what we've learned from the VA around telestroke interventions, as well as a number of other occupational therapy style interventions that you're able to do via telemedicine, this is absolutely something that can be leveraged to not only improve outcomes, but save money in the urban setting as well. So we shouldn't be thinking about this as a purely rural situation, but this is also something that can be done in the urban situation as well. And still, much like we're talking about with the idea of regulation of apps, there are major regulatory barriers in place that are limiting the amount that Medicare providers are able to do that.
Thank you. Anyone else? Thank you very much. I yield back, Mr. Chairman. Appreciate it.